Good afternoon, everybody, and welcome to the weekly Facebook Live update for COVID-19. I'm Justin Westmiller, the Director for Homeland Security and Emergency Management here in St. Clair County. And with me today,
Dr. Annette Mercatante, St. Clair County Health Department.
All right. So before we get into the data, we just want to let everybody know we have to be done at 4 o'clock today for other engagements. So if we don't get to your answer for your question, please send it to us at covid19@stclaircounty.org, and we will get you an answer. All right, let's go with the data. So status report for the 7th, we've had a total of 21,102 total cases, 847 hospitalized, 465 deaths, and 19,747 people have recovered. In the last 7 days, we've seen 484 new cases, averaging just under 70 cases per day at 69.1. We've had 8 COVID deaths in the last 7 days, and our percent positive keeps rising. It's up to 12%, up from 11 last week. As you can see, there's that steady rise, and we haven't seen it come off the top yet and start heading down. So we're still looking for that. And then in the last 7 days, we've had 371 residents get their first dose of the vaccine and 359 get their second dose of the vaccine. So that's pretty on par from where it was last week. So these are a couple of new slides. We're going to provide some school case information that the health department's been provided, just to give a little better picture of what's going on in the county. So from September 1st until September 30th, there's been 346 COVID cases between ages 5 and 18. 87% of those had at least one COVID-19 symptom with a completed case investigation. 3 students have been hospitalized between the ages of 5 and 18, and 1 student has passed away. The school quarantine information from August of 2021 until September 30th, we've had 985 close contacts identified throughout St. Clair County schools, and 10% of those close contacts converted to positive for COVID-19. And then, as always, we want to remind everybody the difference between quarantine and isolation. Quarantine keeps someone who was in close contact with an individual infected with COVID-19 away from others. And isolation is keeping those who are positive or sick with COVID-19 away from others. And then, as always, you can keep up to date on all of our information at stclaircounty.org/offices/health/covid19.aspx. That's our ongoing dashboard.
Yeah, I'd like to make a comment about the quarantine. I just want to make sure people understand that 10% of known exposed students who ultimately converted to positive is quite honestly an underestimate. We know other counties are seeing as much as 20 to 30% of quarantines converting to positive, and we know that our data is collected in a way that makes it difficult to connect those dots and to really be accurate. So I just want to make sure that people know that 10% is, I think, it's pretty safe to say that is an underestimate of the number of cases that convert. And as we continue to monitor this, hopefully we can get a little closer idea of what that number really is.
Yeah, and the other thing, Doc, too, is the either underreporting or lack of reporting for positivity of testing. So that also is not helping, correct?
That is correct.
Okay.
All right, let's get going with the questions. We had one question come through the COVID-19 email for Facebook Live today, and that is, what is protocol for unvaccinated family members where one is hospitalized? Even if others test negative, should they be out in the community?
No. So if you have an individual in your household that has COVID, and I'm very sorry to hear that they're hospitalized, that's unfortunate, but the reality of COVID is that a certain percentage will end up getting quite ill. So everyone in that household then is by definition exposed, and exposed individuals should not be out in the community. exposed individuals should be staying home, ideally for a full 14 days, but we do allow shorter quarantines of 10 days without testing and 7 days with the test out option. So if you are sick, you stay home and hopefully don't end up in the hospital. Or if you test positive, you stay home, and that's for 10 days. If you are exposed, you stay home and check our website to identify the duration of your quarantine.
Okay. The first question on the live feed today is from Betty. She asks, are you recommending getting the third shot from Moderna yet?
Now, the Moderna booster shot's not yet been authorized. So no, we wait till the science has been reviewed by the experts, it's been vetted and published, and then we'll recommend the boosters accordingly. Right now, the only booster is for Pfizer. And they are meeting this month, by the way. So I think an expectation would be probably by the end of October, we might have better answers for Moderna and J&J for boosters.
Okay. The next question is from Penny. She says, if I'm in a different state when Moderna booster becomes available, can I get the vaccine there even though my first and second were given in Michigan?
Sure. Yeah, the vaccine's the vaccine no matter where you go. When it's approved for a booster, though, it'll be approved nationwide. At first, I thought you were asking if it was approved. A booster shot was approved in one state versus the other. But once it's approved, all states will be providing boosters. But yeah, the vaccine is the same regardless of what state you're in. Now, one
Yeah,
thing,
and
a caveat,
there you go.
I just want to say, yeah, if you get another state, it won't end up in our MICR system.
Right,
So
that's
make
what she
sure
wanted to
that you
know.
bring that information with you back to Michigan, and so we can get it into the system, and you can call us with that information. We'll make sure it gets in.
That's what I was about to say.
Mhm.
This is from Kelly. She asks, do you feel like our children and grandkids are being put at risk in the classrooms without masking in place?
Yes, I do. I'm very disappointed with the outcome of the legislative wording of our budget and what we had to do. I was very hopeful that people would continue to follow our policies and our recommendations because that is what we know is the right thing to do and reduces risk. And the feedback I'm receiving this week is those policies are not being followed. So I'm very disappointed. And I'll just say that I'm going to shove this. I'll just say that as we follow outbreaks in the schools, I am even more disappointed. We are definitely seeing more cases in the schools this week. So I'm disappointed. Yes, I'm deeply disappointed.
This is from Martha. Thank you for all you do to keep St. Clair County residents safe and healthy. Keep safe. Laura Jean says, thank you for all you do. Philip says, sounds like a lot of natural herd immunity is growing. Is that true or false?
Yeah, I think it's true. I think it's true. The problem with immunity from natural infection is, number one, you risk hospitalizations and deaths. Okay. And number two, we are really uncertain how long that natural immunity can last. In some individuals, it might be 3 months, other individuals as long as 3 years. And the data is all over the place. So there's no way we can really be confident that natural infection, as it runs through a community, is going to spare us from another wave down the line. So yeah, I do think, in fact, I think this curve, right, that slow curve I got here, I'm doing it backwards instead of the big peak. I think that's from the fact that a lot of people have had infection. Okay, so I guess it's a good thing, but I wouldn't hang my hat on it's going to be our solution. I guess we'll find out when we find out, unfortunately, and that means that we're going to find out at the risk of a lot of people getting sick.
Yeah, and I think, like you're saying, I think that's going to be a patchwork of things too, right? It's going to be the immunity you get from being sick and the vaccines, and there's going to be some new treatments available here very soon. So, it's a good sign that it's not been as steep, right, this time. But that doesn't mean that we can't get another variant that comes in. We're just trying to
doesn't mean we're
do
still
what we
not going
can.
to get into trouble, unfortunately.
That's right.
Yeah.
Absolutely.
Okay, the next question is from Janine. She asks, will there be a pause in certain schools? Example, Port Huron Northern High School. Their numbers are crazy and daily we parents are getting emails of positive students?
Yeah, I'm certain there will be. The combination of just too many ill people and not being able to manage the number of cases will prompt pauses in the schools. I'm quite sure of that.
The next question is from Darlene. She asks, can you explain the difference between COVID-19 and COVID pneumonia? Two people I know have passed away from COVID pneumonia.
So COVID-19 just refers to the illness caused by this particular coronavirus strain, right? The new SARS-CoV-2. And so the 19 was because the year was identified. So COVID-19 means you have the infection. The infection itself can cause all kinds of problems. And pneumonia is the most notorious and probably one of the first things you'll see. Pneumonia fills your lungs up with fluid and makes it difficult to breathe. COVID-19 infections are also notorious for causing inflammatory problems of the kidneys. So kidney failure, multi-organ system failure. So there's a variety of things you can die from as a result of COVID-19 infection. But pneumonia is the most immediate and concerning complication. So that's why your oxygen levels, we worry about oxygen levels falling because as those lungs get inflamed, it becomes more difficult for that air exchange. So when they refer to pneumonia, it's really referring to where the infection is impacting your body the most.
Okay, the next question is from Laura. She said, if a student tests positive for COVID-19 and is in a teacher's classroom and the teacher is with the student in the classroom, is that considered an exposure? Should the teacher be notified that she has been exposed?
Sure. So remember, exposure is within 6 feet for at least 15 minutes. So depending on the classroom situation, and that's regardless of masking, right? So depending on the classroom situation, it's not just being in the room, it's really that proximity. And I would assume that depending on the situation, a teacher might very well be within that proximity to a student. We have to rely on the schools to tell us that information. Unfortunately, I can say that we really just don't get to do that kind of case investigations on everyone, so we often don't find out. So you have to assess that situation. When you find out somebody's been positive in your work environment or school environment, you have to kind of think about, where was I in relationship to that person and how long was I there? And that would define your exposure.
Okay. Jonathan asked, what do you think about the 400 doctors and nurses that quit Henry Ford Hospital because they don't want the vaccine? And that's happening in many places.
Yeah, it's a very unfortunate situation. It's certainly, we already have a shortage of healthcare workers. I don't know, maybe Justin, you want to say this is more, I think, of an economic, political statement. The thing that strikes me as odd is the strong opposition to the vaccine, because it's a great vaccine. And I think for medical people, if they understand what's going on, it seems odd to me that they would rather lose their job than be vaccinated. I consider that with a certain amount of open-mindedness, but I think there's just a lot of, there's a lot of crap out there, a lot of bad information that people are just getting inundated with, and it's confusing people. So everyone has that right. They have a right to quit. It is putting our healthcare system in a very precarious place. There's no question that the more healthcare workers we lose, the less able we are going to be able to manage the increase, the inevitable increase we're going to see in hospitalizations with what we're seeing now in our county and our state. We are absolutely going to see more hospitalizations in the coming week. So it stands to reason we need more healthcare providers, not less. So I think all these have to be kind of put into perspective, and I think these are really trying times, real trying times. Justin, I don't know what you think about that.
Yeah, and I think that, we have a very interesting, there's public health and there's societal beliefs, and we give everybody the right to believe in whatever they want to believe in. And I think this pandemic response has struggled from the beginning to stay on message and provide the right and correct information to people. And in the vacuum of that, all sorts of bad information has been able to be put out there. And so there's no getting that cat back in the bag. We just have to work to continue to educate the ones and twos until we get to a point where we can potentially turn this endemic and prepare for the next potential pandemic that may be right around the corner.
I heard a great term today. There is a lot of agents of disinformation out there, and I
Absolutely.
can see this, and it is coordinated. And I do think it's causing a great deal of harm. These aren't just random pieces of misinformation that are getting shared with different people. I think there is a very dedicated purpose, and I don't know why this would be. This is what bothers me. Why there would be such a dedicated purpose of disinformation to kind of scatter our community like this and push it in so many directions. It's quite alarming.
Yeah, and it's really showing our overseas, enemies and our foreign policy folks. It's really showing a lot of our country's weaknesses that we have to be really careful about. So that's what I think from my Homeland Security line.
Okay. Janine asked, who makes the decision to pause the schools?
It's a combination decision between the schools and us. If it's very clear that the school is having trouble and it's getting worse and they won't pause, we can and will pause. I would say up to this point, the schools are almost always the ones that are very aware that they're in an issue, they're having an issue, and they reach out and just kind of let us know this is where they have to go, and then we support it. So it could go either way.
All right. Chris just wanted to make a comment. She said, when you were talking about the pneumonia, they also die from bilateral pulmonary embolism. Sadly, that happened to my precious mother.
Oh, I'm so sorry. Yeah, this virus is it's a striking virus. I've said this before. It is unlike most of the viruses we've had to deal with. It causes a unique pattern of thromboembolism in people, a lot of clotting type issues, which I think leads to a lot of the multi-organ failure issues, but much more so than most of the other viruses that I've experienced in my career. So I'm very sorry to hear of your loss. It's a brutal virus. It really is.
Lisa said, Justin, on your last comment, very well said. Comment, Justin. Darlene asked, how long after you've had COVID, even hospital cases, can someone get the vaccine? I was asked that question.
We're asked that question a lot, and the answer is as soon as you recover. You can assume that you have some immunity from being previously infected. I mentioned before, we don't know how long that immunity is going to last. So we advise even people that have had infections to get vaccinated. Certainly, we know that 3-month period is pretty solid, but you can actually you don't have to wait 3 months. You can get vaccinated as soon as you have recovered. We don't want you to get vaccinated if you're still feeling really crummy and, and on oxygen and all that stuff. But as soon as you're feeling better, we recommend that you get vaccinated.
All right. Penny said, thank you for all the great information. Very helpful. Lisa said, the misinformed seem to believe they are really the informed.
I know. That's the problem. They don't know what they don't know, and they think they know something that they really don't really have the full picture of. And that's because, let's face it, vaccinology and immunology is a very complex science. It is very complex, and it's very hard to for people really to understand all the nuances of it. So I agree.
Okay. And we don't have any more question. Oh, one more, looks like, from Timothy. Can you get the booster after you've been sick and on steroids and antibiotics?
Yeah, you can, but so if you've been on a prolonged course of steroids, I would probably wait a couple weeks, okay, just to let your immune system kind of crank back up. Again, if you were that sick and you were on steroids and antibiotics, wait till you're feeling better. Remember, the booster is a booster. It's there to give you an added benefit. And everybody who's had a full series of any of the other vaccines probably has a pretty good immunity still. We feel that that booster is going to benefit the population as a whole, but I think for an individual, I don't want you to feel like, oh my God, I got to go out and get that booster tomorrow, right? Wait till you're feeling better, and then you'll benefit. Probably more likely will be a greater benefit to you.
Okay. I don't see any more questions coming through at this time. Did you want to say anything about, oh, hold on. Oh, yep, no more questions, just some more comments. Do you want to say anything about the rescission last week when we were on? We were talking about, we weren't sure, but then later that evening, we had rescinded the order. Do you want to say
Oh
any
my
comments
God,
about that?
that was a week ago, wasn't it, Jen?
That was
Oh
1 week
my,
ago.
that's a long day.
It
Yeah.
was.
So, it was a very difficult decision. I'll just say that. I've kind of chewed on this for a week already, and but I think we felt that we were guided by like everything we recommend. You guys are guided by expert opinions, and we believe public health has a lot of expertise in control of a communicable disease and infection like this. But we were guided in this situation by our legal counsel, and this is the political realm that COVID has taken on. So the rescinding of that order was based on the politics and the legislative and movements that are going on, and it was felt to be in our best interest to follow the letter of the law, as we always do. And since this law is in a real upheaval, some say it's unenforceable. The governor says that, and others are filing lawsuits to enforce it. I think the thought was that we just need to follow the letter of law and let the lawyers and the legislators and the politicians just crank this out. Now, with that said, as I mentioned briefly, I was um, very hopeful that people would still do the right thing. Okay, here's the science. Here's what the virus does. Here's what you need to avoid getting or spreading the infection to other people. And I was quite hopeful and optimistic that as a community, we would just limp along and do that. A week later, I'm not as optimistic, but I am still hoping that we can pull this together and do the right thing without having to shove laws and orders down people's throats. So we'll just continue to watch and do the surveillance as we do, and try and convince people that it's not cool to make other people sick. Okay. Even if you're a kid, it's not cool to make other people sick. And so we really just need to keep doing the things we know work and avoiding the things we know don't work, like being in crowds and going out while you're ill, and disregarding exposures and all those things. I'm sounding a little bit, I know I'm sounding a little snarky, and I apologize, but it's been a long week. And so that's really kind of how that rescinding order got decided. And now we'll just have to move forward and see what happens in our community as far as the disease goes. But everybody, I just want to say this. No, one more thing. Everybody can still take control of the situation. All right. Everyone, this is all about our authority. This is all about public health authority and whether or not we should have it or shouldn't have it or blah, blah, blah. Okay. So that's the legal question. Take away our authority, we still know what we're talking about. And if people did what we said works, we'd all be okay. We'd all be okay. And you wouldn't have to worry about whether or not we have this authority or not. So I'm just kind of putting that out as a plea. Even if you don't care if you get sick, a lot of people around you care if they get sick. And it's not too late. It's really not too late for us to do this for each other. Okay.
And before you get to the next question,
Mm-hmm.
Jen, I saw down in the comments where Aaron said, well, it's 99.8% survival. So
Right.
that's really great. That's really great. Except if you figure a 12% positivity rate, that's 912,000 people that have the potential to die from this. That doesn't seem like it's a really great number. That's more than twice the number of humans that the United States lost in World War II. And we're talking about in less than 3 years. And that war dragged on for 5.5 years. So it just doesn't seem proportionate to me, even though it's 99.8%. Like, I
Stop.
get it.
We have a
No, that,
2% mortality rate. I've always said that. We
well,
have
that's what
1
I'm,
in
yeah, yeah,
50 people in our county who get infected die. Okay. And the people who don't die and are hospitalized are on vents for
yeah.
weeks at a time, have to relearn how to speak. Let's not even talk about the pain and suffering of lost revenue and income. You know, people, this is just not an argument that stands up.
No,
So you
not at
can
all.
do your statistical blah blah
And that
blah,
was my
but
point.
we're not
That was my
buying it.
point.
No,
Yeah,
we're not
yeah.
buying it. It's important.
Yeah.
Okay.
And this has come from somebody who's not in public health and not in, on the medical side. I'm just in the business of supporting people who can save lives and saving lives. That's what I did in my prior job. So, uh, you know, there's a lot of life available here that many people are just throwing by the wayside because it fits their narrative, and we just got to be careful with that.
Okay, a couple more questions before we have to go. And again, if you're just joining us, we have to cut off at 4 o'clock today. Becky asked, will there be mobile flu clinics starting up soon?
What's a mobile flu clinic? Like a little,
Maybe a
like a
pop-up?
van
I'm
going
not sure.
around? I don't know that we have those plans in place. No.
But flu clinics, you can get
Flu
vaccinated
shots are
here,
available. You can get them at
pharmacies.
your pharmacy. You can get them at your doctor's office. There's ample amounts of flu vaccine. Yeah, but you'll have to come to it. I don't think we have a mobile unit plan. It's a great idea. We're a little overwhelmed right now, so maybe we can
There are
put that
lots of
on the burner
places.
for. Yeah, maybe we can look at that in the future. It's a great idea.
Rachel asked, are we testing people for antibodies that have already had the disease?
Well, I think the doctors are, but we've talked about that, and antibodies are difficult to interpret. There's a lot of variability in antibodies as far as what type of antibodies. Are they IgAs, IgGs, IgMs? We don't know what antibody titers mean. We don't know what level of antibodies are protective and which ones aren't. There's a lot of variability in the antibody tests themselves. It's a wild, wild west out there when it comes to tests. So unless, there's and there will be a time now coming up where we'll have much better idea of which antibodies are reliable, which tests are reliable, which ones aren't. But we're not there yet, people. So if you get an antibody test, good luck interpreting what it means. Because I'm telling you right now, it does not necessarily mean you're protected, nor does it necessarily mean you do not need a vaccine. In fact, it absolutely doesn't mean you don't need a vaccine. Antibody testing is problematic at this point. I am assuming that it will be very helpful in the future, but right now it's not.
And here's a little anecdote for you too. So we're talking about, viruses and pandemics, and so take the smallpox issue. It first popped up, and it was in the world forever, but the United States took it up during Thomas Jefferson's presidency, and we didn't fully get rid of it in the world until 1962. So that's quite a period of time, over 150 years, where, and in a lot of those years we had vaccine, but we were still struggling to get it under control because of all the same things we're seeing now. It was just easier to communicate once a day back then instead of every minute of the day on Facebook.
Okay, Lisa asks, where can uninsured people get a flu shot? Uninsured.
Well, you can come here by any means. I believe we have a set minimal price for the vaccine. I don't believe it's free. Um,
How about People's Clinic?
People's Clinic. I was just there today, and I don't know if they have their flu vaccine. I forgot to ask that, but People's Clinic is always an option. Flu vaccine is relatively inexpensive, though, and I do want to encourage people to seek it out. There are often free vaccine clinics in the community, so watch your papers, and I think if we see any of those pop up, we'll also advise accordingly. So I'm sorry, that's kind of an inadequate answer, but we'll keep that on our radar and see if we can figure out how we can facilitate that a little better.
Okay, and Margie asked, does it make your COVID vaccine less effective if you take Azithromycin tablets for an ear infection a few days after you get your vaccination?
It shouldn't. I was thinking you're going to go somewhere else, Margie, with flu vaccine and COVID vaccine, and you can get them together and they don't interfere with each other. But antibiotics have nothing to do with your immune system. Antibiotics work directly on the bacteria that it's fighting. Remember, antibiotics don't treat viruses. And the vaccine that we are giving allows your immune system to recognize the viral protein. So there's no relationship there, and there shouldn't be any problem that I can think of.
And Rachel followed up with, how do we know the efficacy of a vaccine if we aren't going off the antibodies it produces?
By disease prevention, primarily. The clinical trials were really done on how many people got sick with COVID after receiving the vaccine. And it's very clear with our local data and very clear with the national data that a lot fewer people, what do we think? Are we still at 1%? Of individuals that are vaccinated actually go on to get infected. So that's really where the clinical trials were done, not based on, and now they do measure antibodies in the clinical trials which is why we're giving boosters, because of the neutralizing antibodies it produces. But that's in an academic situation, not in the real world situation that the previous person was talking about.
All right, that's it for our questions. It's 4:01, and I'll just end with this. Thank you to everybody who commented. Thank you to you guys and our team for all of our hard work. So we appreciate all those positive comments. So any closing comments before we go?
I already did mine. Justin.
Yeah, so again, I appreciate you guys having me back. It's fun to get the gang back together, and just hoping and wishing for everybody to stay healthy out there. And, you know, my office is always available if there's anything we can do.
Do the right thing. If you're sick, stay home for 10 days. If you've been exposed, check our website out so you can see what your quarantine period should look like. Thank you, everybody.
See you.